Hello, everybody. I just started about 30 seconds ago and I thought I'd started, but I hadn't switched the thing on. So just shows you what I'm like with IT. But good evening, everybody. My name is Charles Kingsland, Professor Charles Kingsland. I'm the Chief Medical Officer for Care Fertility. So welcome to our information evening. So tonight, what we're going to do is spend 45 minutes or so talking you through the IVF process, what to expect, what are the pitfalls, the cost, and all the other information that you might need to help you through your IVF journey with Care. I'll also be answering questions, some medical questions, because I'm a bit better at medicine than I am at IT, throughout the evening. And so if you want to put your questions to our team who are in the background waiting to answer, waiting to receive those questions by email, then just fire away. If we don't get time to answer the question, we've already got quite a few, what we'll do is we'll get back to you after the program has finished. So to start off with, we're going to play you a video about the background of Care and what to expect, and then I'll come back to you a little bit later on. So if we can just play that video now, Jess, that would be great.
Family. It's who we are and who we're always going to be. It's the important little moments, the big emotions, the beating heart at the centre of our world. It's the journey that we take there, together, one step at a time. Family is the one thing we'll always care about the most, because we believe that family is for everyone. And through our care, we'll do everything we can to make your dream real. We don't just care, we are Care.
My name is Professor Charles Kingsland, and I'm the Group Clinical Director for Care Fertility. At Care, our number one belief is family for everyone, and this means we do everything possible to help everyone start or grow their family. We know that nothing is as important as family, and that's why we care so much about wanting to give every patient that comes to us their best chance of having a baby. Of course, families come in all shapes and sizes. We get heterosexual couples, couples of the same sex, we get single patients wanting to start a family, we get NHS patients. When you have a fertility problem, there should be facilities available for you to get the best advice and the best treatment readily available to give you the best chance of having a baby at a time in your life that is best for you. We will use all our knowledge and experience combined with highly individualized treatment, personal treatment, to help you have the family you are longing for.
Unbeknown to Gemma and I, we both carry a gene, a deafness gene. We actually have a daughter who was 3, but who was born prematurely deaf. And we were given the option and chose to go down a fertility treatment to kind of avoid our second child having that same gene.
We were very lucky in the fact that the clinic was only down the road from us. So we felt there was one around the corner. It had good reviews. We just felt it was good for us, didn't we?
The whole package made us just feel really comfortable that actually going with Care was the right decision.
So the team that we worked with at Care were unbelievable. They were caring, they were sensitive, they were compassionate, empathetic. And even when I was ringing out with I was feeling pains down one side, that the reassurance that they gave me, they honestly do hold your hand every single step of the way, and I feel like they lived the journey with us.
So I've had several treatments with Care, and I now have a baby, and that's taken a number of treatments, fertility treatments, different alternatives, different medicines to try and get it to work for me. I have always said I would recommend Care Fertility. I would recommend them for the comfort factor that I received, the friendliness, and just I think the word is my faith in Care Fertility.
Okay. So what we're going to do now in the next few slides is to take you through the process of IVF and hopefully demystify some of the factors in that particular process. So could we have the next slide, please? Yes. So here we are. We started Care Fertility. The first clinic was in Nottingham in 1997. And then we acquired some further clinics slowly, but over the past 5-6 years, the Care family has grown quite quickly, and now we cover over a large area of Britain. I think we now have 25 clinics. 15 of them have laboratories, and the others are what we call satellite clinics. They're the clinics where you can get the treatment and the scanning and the preliminary workup, but then you go to the main clinic based in our bigger centres, which will still be close to you. But the idea of the satellite clinics that they're all local to you, so you don't have to travel very far, and the treatment will be as minimally disruptive to your everyday life as possible. Next slide, please, Jess. We have a general inquiries team, and their representatives from the GEM team are on hand tonight to answer any of your queries that you might have and you want to put online. This is Shah, one of our members of our team, and she's the general inquiries team manager, and she oversees all the inquiries and filters them through to the respective clinics. Now, I have been told that if following tonight's event you would like to have a consultation with us, if you quote online event, then you will get a reduced consultation fee, and that runs till the 31st of May. Next slide, please. So, as with any medical problem, and infertility is a medical disorder and not only can it be very stressful, but actually getting the right diagnosis can be stressful. So it's crucial that you get pointed in the right direction as quickly as possible, so that we can make the appropriate diagnosis for you. And of course, if we have the right diagnosis, we can put you on the pathway to the correct treatment to give you the best chance of achieving a pregnancy as quickly as possible. There are a number of tests that we would want to do, not as many as you think, because we would want to do the key tests quickly to get that diagnosis for you. Other tests may come later, but the key tests are very simple, very straightforward. They involve a sperm test, a blood test, and a scan. And on the basis of those, depending on your history, we can make the diagnosis and get you started on the right track. Next slide, please. As I said before, we have a huge number of staff. We now have over 60 consultant gynecologists and a staff complement of 1,000 now across the 25 clinics, all working to help you to achieve the pregnancy that you so desire. The nice thing about having so many clinics is that we can talk to each other. Each of our clinics has a particular expertise, and obviously, having been in the specialty for many, many years, we have a lot of experience, and that we can talk to each other about individual cases and get the best advice for you as an individual. So your treatment is individualized for your particular needs. We also have a portal, so that when you join us, we can put all the information on your portal. You can ask questions, and in turn we can reciprocate, answer those questions, send you information that you might need, the relevant consent forms, and also your blood test results, and interpret those for you on your portal. Next slide, please. So, as with most things, the initial treatment or investigation starts with your consultation. You can book a consultation with us through our GEM team, our General Inquiries Management team. Here is one of my colleagues. It's George. He sits in Sheffield, and we will take a full medical history. Not only do we want to know about how long you've been trying for a baby, your gynecological history, but your past medical history and social history, occupational history. These are the sort of things that we need to know that might influence the diagnosis, and put all those together to make the relevant conclusions about your particular problem. Next slide, please. So, many of you, but not all of you, once you've had the diagnosis made, will end up being advised to undergo in vitro fertilization. As I said, not all of you will need that, but by virtue of the fact that you've come to such a specialized clinic as CARE, then we will assume that that is why you are here, and that's what I'm going to go through tonight. So the IVF process is fairly standard. It's nowhere near as complicated as you might think it is, particularly if you read social media or media outlets, newspapers. They seem to portray that IVF is very complicated, but it's not. It takes a series of steps that you have to go through. The first one is ovarian stimulation. So we don't, when you start your IVF process, we don't just want you to get one egg as you would normally get in a natural cycle. We want to stimulate your ovaries using hormones to get as many eggs as we safely can, because the more eggs we get, the better is your chance of achieving a pregnancy. We don't want too many eggs, but we want as many as we safely can get. And that involves you having daily injections of a hormone that your body produces itself, but we give you that hormone in a much higher dose. Next slide, please. As with all the steps, we will teach you how to do the injections so that you can do them yourself, or we can get a friend to do them, or if you feel that is you're unable to give the injections yourself, then you can pop along to your local clinic and we can administer them. But most people, the vast majority, will, after a tuition, simple tutorial, will be able to give those injections yourself. And really, it's just like being a diabetic for 10 or 12 days. The needle is very fine, the injections are easy to administer, and they are relatively pain-free. Next slide. We have to monitor the progress of your ovarian, of your egg growth. The eggs grow in little follicles. The little follicles are fluid-filled sacs that we can monitor on ultrasound scan. So we will ask you to attend your local clinic or your local satellite clinic once, twice, or 3 times, so that we can assess the progress of the growth of your follicles. And that involves you having a vaginal ultrasound scan. The ultrasound scan is fairly minimally invasive. We just put a small probe into the vagina and press it against the top of your vagina so that you can see those ovaries very clearly, and we can measure the response of the follicles in your ovary. Takes about 2 to 3 minutes to do. Next slide, please. Once your follicles have reached a particular size, and normally we would expect 3 follicles to reach 2 centimeters in diameter. That means that the chances are that the eggs within those follicles are then ripe. So once those those follicles have been measured and we think that they are ready, it's normally after about 9 or 10 days of injections, we will then give you a trigger dose of a hormone that completes the maturation of those eggs. And that takes about 36 hours to do. And so after that injection, we will bring you along to the clinic approximately 36 hours after that injection, which will therefore take place late at night. So the following day, you're on your own. And then the next day, you come in for your egg collection at a time when those eggs are at their most mature. Next slide, please. Now, this, of course, when you come along for your egg collection, the egg collection will be done under sedation. So you are not anesthetized, but you are sedated. And that means you're a bit zonked out. You are relatively pain-free. It's not for the vast majority of patients, the treatment, the egg collection is not that uncomfortable. It's perfectly tolerable. It takes about 10 minutes to do. And you, as I said before, you are sedated. So you're still conscious, but you're a bit woozy. And we give you plenty of painkiller so that the egg collection is relatively pain-free. At the same time, the sperm, whether you're a same-sex couple or a heterosex couple, the sperm that you've been allocated will be prepared. So we ask the male partner, if you're in a heterosexual relationship, or the sperm that's already been prepared, that if you're in a same-sex relationship, that sperm is then collected and prepared. Next slide, please. So, as I said, the sperm is collected and prepared, and the eggs are collected from your ovary. The way that the eggs are collected from your ovary is a small needle is placed into the ovary through the top of the vagina. The actual ovary is very close to the top of the vagina. So the needle is placed through the top of the vagina and into the ovary, and the follicles are aspirated. The fluid is taken out of the follicle and placed in a little dish, and the embryologist will then look for the egg in that follicular fluid. Okay, once we've collected all the eggs, you will then get up, have a cup of tea, and once you've passed urine, you'll be ready to go home. I would suggest that you certainly won't be feeling well enough. You'll be feeling a little bit uncomfortable. So you'll need to go home and rest for the rest of the day and maybe the next day. But you should be able to, carry on your whatever, social commitments you have. Maybe you might need to take a couple of days off, but some patients will be great to go to work the following day. It's down to the individual. It's how you particularly feel. So we've got the eggs, we've got the sperm. We then hand them over to our expert embryologists, and then they will fertilize the eggs either by in vitro fertilization. So if the sperm count is normal, 100,000 eggs are placed, 100,000 sperm are placed with the eggs and put into the incubator. In some cases where the sperm count is low, we will do something called ICSI, that is intracytoplasmic sperm injection. And that's where a single sperm is placed into the ovary with a very fine pipette. And I think we've got a video of that. And we Jess, if we could just play the next slide. Here we are. So this is an ICSI. This is where the sperm is being injected directly into the egg. You can see the sperm being a part of the cytoplasm of the egg is being sucked up, and then down goes the sperm. There goes the sperm into the egg, and you've got fertilized egg. Now that you've got to remember, the egg will sit on the sharp end of a pin. And the sperm and that little needle that the sperm was propelled down is the size of a human hair. So our embryologists are pretty skilled at what they do. Next slide, please. Then over the next 3, 4, or 5 days, the growth and development of those eggs are monitored. We have a particular monitoring system which we call care maps, and it's the technology is what we call time lapse. So what happens is that we will video the growth and development of those embryos every 10 minutes. Not only do we watch the growth, but we watch how quickly the embryos divide. And these these factors are then put into a computer algorithm, and then that will tell us which embryos are likely to turn into babies. And this is a picture now of a diagram, a video of an embryo growing and developing over 2, 3, 4, 5 days. And as you can see now, this is going particularly quickly. The embryo is now hatching, and that is an embryo at 5 days old. Now, all that information we will then put into, as I said, an algorithm, time care maps, and that will then tell us which embryos are likely to turn into babies. It's a very, very clever technique that has been perfected over many years, and over 500,000 embryos have been monitored with regard to growth and development to enable us to give as accurate information as possible. And of course, you can see that video if you want. We can provide you with that video so you can see the growth and development of your embryo or your embryos. So after 3, 4, or 5 days, depending on how the embryos grow and develop, then we will have a number of embryos for you ready to be replaced. Now, we can either freeze them all, which is a very safe technique to do, or we can put one back fresh. But the technique is the same. So let's just say, for example, you have decided, or we've decided with you, to put one embryo back fresh. You come along 5 days after your egg collection, and this is performed under, you don't need any sedation. It's a very quick and relatively simple process. We will load one embryo into a fine catheter and thread that catheter through the cervix and into your uterus. And we very gently expel that embryo into the cavity of your uterus. We have to be careful to put that embryo in as gently as possible, because if you that embryo is very, very tiny, so it has to be dribbled into your uterus as opposed to shot into it. So sometimes after we've done the embryo transfer, the embryo, we might not have pushed that plunger hard enough, and the embryo will still be in the catheter. That's why we check to make sure the embryo's gone. And every 10% or so of embryo transfers, the embryo will still be in the transfer catheter, so we have to put it back. And that's actually a very good quality assessment, because it gives us an idea that we're actually doing the procedure gently enough. After the embryo transfer, you can get up and walk away, and the embryo is very safe, because what you have to remember is an embryo is just like a bubble in a bottle of pop. Once you if you turn the bottle of pop upside down, the bubble will float further up. So as you get up, the embryo will float further away. So it's not as if it's going to drop out. Actually, there is no evidence to suggest that resting or lying down for any length of time after an embryo transfer is going to improve your chances. Obviously, you don't want to go mad, and you don't want to do too many stressful things afterwards, but you just take it easy, just do normal things, keep the blood flowing, keep walking around, rest when you can, and try not to have, after the embryo transfer, too many stressful things going on in your life, because you want to keep your adrenaline down and nice and low, and keep the blood pumping, and keep having, you know, the positive thoughts, because all that can contribute to the success that you want. Next slide, please. Now, sometimes it may so happen that our patients may not have eggs, or run out of their supply of eggs, or may have no sperm, in which case we can offer something that we call gamete donation, either egg donation or sperm donation. This is where we will, a donor will provide eggs for you or sperm for you, and we will match the donor to the characteristics that you have: color of hair, color of skin, height, physical appearance. We can't be with physical appearance, it's a little bit less to get an absolute accurate match, but we can do as much as we can to get a donor matched as closely as possible. And at Care, because we are, you know, the biggest provider of fertility services in Britain, we have our own donation bank of sperm and eggs. So we've got a large donation service that can cater for your needs and provide that continuity of care that you need. Next slide, please. As I've said before, fertility is a pretty stressful situation to be in, and it's not helped by the treatment that you undergo. And of course, we recognize that all of you will be under varying levels of stress. And what we want to do is to give you all the support you need, that you need as an individual, because we're all different. We all have individual needs, and we are at hand to provide that care for you. So if you do have particular issues, particular anxieties, just give us a ring, and we can provide the support. Where we hope to provide as much support as you will need. But as I say, most of you will tolerate the procedure very, very well. But if you do need that extra bit of support, we're here for you. Next slide, please. Now, another really stressful pinch point is that many of you will not get NHS IVF treatment. IVF is a very high profile disorder, but it's a very low priority within the NHS, and only 0.1% of the NHS budget is spent on fertility. Now, I could talk for hours about the inequalities of IVF treatment, but we don't have time tonight. Safe to say is that many of you will not be eligible for NHS treatment, so you will have to fund that treatment yourself. Now, at Care, we recognize that in itself can be an additional stress, so we want to be as seamless as we possibly can. So we have an in-house payment system which we call Care Pay, and we try and tailor it as we do the treatments to your particular circumstances. We have an IVF multi-cycle program, an IVF refund program. We also have a donor IVF refund program. We can provide all that information for you, the funding, how it's all set up, what you need to do next. And as I said before, the GEM team will be on hand to help you through that financial minefield, because it is a stressful business when you're having to fund that treatment yourself. So we provide that advice as well. Next slide, please. So there's the number that you need to call if you have any inquiries queries that you want to ask us for. We're here till later on this evening, and if not, we can leave a message and we'll get back to you. So I think we've got another video now, Jess. So if you could Oh no, I know what we'll do now. Let's answer a few questions. So we've got lots and lots of questions coming through. First one, can I improve egg quality at 44? Is an AMH, and my AMH is good. Now, that might sound a bit technical to all of you, but what I would say is, to answer that question, the difference between boys and girls, and if I said it once, I'll say it many, many more times. Boys are sperm factories. We have all the ingredients in our bodies to make sperm every day of the week. Some days we're good at it, some days we're bad at it. But it takes us about 6 weeks to make a sperm. We ejaculate them out, and then we make some more. So really, we can, in theory, reproduce up until the day we die. Our sperm, as we get older, certainly in our 40s and 50s, declines in quality, but it's still there. And as you probably heard in the news recently, Robert De Niro just fathered his 7th child at the age of 79. Quite why he wanted to do that, I'm not sure, but that's for him. Girls, on the other hand, are egg warehouses. All women's eggs are in their ovaries on the day they're born, and you can't make eggs. You can't make them better. What you can do is stop them from getting worse. But as you age, the egg quality declines with you. It declines quite rapidly over the age of 35, unfortunately, and then it drops like a stone over the age of 40. What we can do, we can do a blood test called AMH. AMH stands for anti-Mullerian hormone, and that's the hormone that's produced by your eggs. The more eggs you've got, the more AMH you've got. It doesn't tell you about the quality of your eggs. It tells you about the quantity. So if you're 44 years old with a high AMH, that means you've got a good supply of eggs. But those eggs are 44 years old. So inevitably, they will be less fertile than they were when you're 24. But that's the way of the world. That's the way it goes these days. Most of our patients that come to see us are over the age of 38. So already we're chasing that age factor. But it's better to have an AMH of over 40, of a high AMH of 44 than a low AMH. So what I would say is that it's not the best place to start being at the age of 44, but it's worthwhile if you are that age to seek treatment as quickly as possible. Can you improve egg quality? Well, you can stop smoking, reduce alcohol, improve your body mass index. People are most fertile when their body mass is between 20 and 25. Your body mass, the way to work out your body mass index is your weight in kilograms over your height in meters squared. Okay, should be between 20 and 25. There is no doubt that if your body mass goes up over 25, certainly over 30, your fertility comes down. Similarly, if your body mass is below 20, your fertility is lower. So if you can keep it between 20 and 25, then that's ideal. Folic acid, definitely. That doesn't improve your egg quality, but it improves your chance of having a healthy baby. There are lots of things that we advocate, or you'll see in the health food shops, but these are not necessarily scientifically proven. Things like multivitamins, vitamin D is actually won't do you any harm at all. But there are some things that may not be a benefit or may be very expensive that you need to you need to think very carefully. You'll get the correct advice before you go ahead. Coenzyme Q10 is probably worthwhile thinking about, as is DHEA, dihydroepiandrosterone dione acetate. These are both hormones and products that might have been suggested might improve your egg quality, but it's never been proven. So you've got to weigh up the risks of buying them, because some of them are not cheap. against the benefits that you'll get. And the best person to advise you is your gynecologist in the fertility clinic. Recurrent implantation failure. What should I do next? Well, we have experts in recurrent implantation failure. This is where you might have had a number of embryo transfers that have not worked, or indeed they have worked and you've gone on to miscarry. The two are not necessarily linked, but there is one common factor that I think you should think about, and that is the quality of your embryo. As I said, CareMaps measures what we call the morphokinetic characteristics. That is, do they look pretty? Have they grown well? Have they divided well? And we can be fairly accurate at predicting which embryos are normal. But the only way to be absolutely sure is to biopsy the embryo. Take 1 or 2 cells or 4 or 5 cells out of that embryo and look at the genetics, look at the chromosomes to make sure the chromosomes are normal. That is the commonest cause of implantation failure, that the chromosomes in that embryo are not normal. 50% of all the embryos we make naturally are chromosomally abnormal. When you get to the age of 40, 75% of all the embryos that you create are chromosomally abnormal. That's why we lose our fertility. The uterus, the womb, doesn't lose its ability to hold on to normal embryos, but our ability to make normal embryos decreases as we get older, as the eggs and sperm become more defective. So the test that we do is PGTA, and it's worthwhile thinking about that test if you've had recurrent implantation failure. There are other tests that we can do on the lining of the womb. Endometrial receptivity assays are the one that comes readily to mind that you would need advice about, because they're not for everybody, and then they shouldn't be treated, and all these tests are not suitable for everybody. They might be good for you, but they might not be of benefit to the next person. So the person to speak to is your gynecologist or your advanced nurse practitioner in the fertility clinic, and they will give you advice as to what are the best steps for you to take with regard to your recurrent implantation failure to give you the best chance of achieving a pregnancy. PCOS, will I be on a high dose stimulation? PCOS stands for polycystic ovarian syndrome. And that, in a nutshell, means generally speaking, you've got a lot of eggs of variable quality. And so stimulation usually is on the low side. We don't give high dose stimulation, generally speaking, for polycystic ovarian syndrome. We give low stimulation because usually the threshold for getting those eggs to grow and mature is low, and we don't want to go over the top and overdose you so that you get ovarian hyperstimulation syndrome, which is a pretty nasty thing to have, and it's one of the very rare, thankfully, side effects of IVF. So we tend to try and avoid that and go for a low stimulation. What lifestyle improvements can we make pre and during treatment? Actually, they are very, very basic, and it's what we would say for many disorders. Good diet, cut out the rubbish, okay? Just eat a good, wholesome diet. Try and cut down on your alcohol. I can't be a hypocrite and say miss out on alcohol altogether, because my life would be misery without alcohol, but not too much, okay? 5 units a week is fine. You know, once you start getting over 10 units, that's too much. So when you know, it's like preparing for, you know, a sports event. You've got to hit that sports event being as fit as possible. Good quality diet, cut out alcohol. Smoking, stop smoking altogether. Try and get down to your boxing weight. Body mass index 20 to 25. If your body mass is too high, do your best. Because dieting is very difficult. I'm not suggesting there's any magic formula. But the formula you should adhere to is expend more calories than you take in. If you're taking in lots of calories, you're not expending them, you're going to put weight on. So use more calories than you take in. That's the golden rule. Drink lots of fluid. Get lots of sleep. Get lots of rest. 8 hours sleep. 1 hour before midnight is worth 2 hours after midnight. It's really important, and increasingly we're getting more evidence to suggest that sleep is good for you. Boys, testicles like to be cool. Sperm like to be produced in the cool weather. So boxer shorts, lots of no hot baths, stop smoking, be very careful about vitamins and minerals. Take advice before you start taking them, particularly and nutrient supplements as well. And the public enemy or testicular enemy number one is steroids that you take in the gym to bring up your, to increase your muscle mass, or even protein drinks, those sort of proteinaceous gym bunny type drinks. Sometimes they've got trace elements of testosterone, which may not be good for you. You can be too fit. Testosterone may be good for your muscles and may be good for your strength, but I can tell you now, it's not good for your testicles. Okay, so they're the basics that I would adhere to. Now, I think I'll just do one more before we go into our next little video. I'm due a laparoscopy through the NHS. Approximate time 6 months from now. NHS have suggested this before IVF. I'm 32 and would like to get moving and would like to know if I can bypass laparoscopy and go private with IVF through personal choice. Any advice is much appreciated. Of course you can. Of course you can. Depends what your laparoscopy is for, and I'm not suggesting that you would should avoid the laparoscopy, but it may be that it's not necessary for your fertility. My advice to you would be get a second opinion. If you're in doubt or you think, well, hang on a minute, I'm not sure about that, I'm going to get a second opinion, then you're within your right. And that's a classic example of what I would say provokes anxiety. If you're not happy, if you've got that gut feeling, well, hang on a minute, no, I'm not actually sure about this, get a second opinion. Unfortunately, the way the NHS is and the way that British medicine is, you might have to pay for it, but it's 150 quid that may be, well worth it, because if it gets rid of that anxiety, then do it. Okay, so as I said before, we've got lots of questions coming through. I can't answer them all now because we run out of time, but we will get back to you and hopefully make you feel a bit better. Go on, I'll just do one more. If you've had a transvaginal ultrasound and indicated you've got a septate uterus, 7 millimeters, does it affect implantation? Nah, we're all a bit, if we look on the inside, if doctors look on the inside of you, sooner or later we'll find something wrong with you. And if, I've done thousands of cesarean sections and thousands of operations, and uteruses are not just, perfect. There'll always be a bit of a divot here and there, the same as, having a big nose or funny ears or, jowls or something like that. Doesn't mean to say it's abnormal. Doesn't mean to say it's not, it's not going to work. A septate uterus is 7 millimeters. Nah, that's fine. It's normal. If you said it was 3 centimeters, that big, well, yeah, that's different. But it's 7 millimeters. It's hardly the size of a finger. That's not going to cause you any problem at all. And don't let anybody start saying, oh, that needs to come out, because it doesn't, okay? Because it won't affect things. It will not affect things. Okay, so I think I'm getting the red light here. I'm going on a bit because I do talk quite a bit, so I've been told. So shall we just go on with the next video, Jess, if that's okay?
I'm Shah, and I manage CARE's new patient inquiry team. We're here to make it easy for you to take your very first step in your fertility journey. We completely understand how nervous and excited you might be when you contact us. This is the start of a life-changing process and hopefully the beginning of an amazing future as a family. So it's really important that we give you all the information you need. That way, we can help you to feel much more comfortable and confident with your treatment. Whatever you need to talk about, I want to reassure you that no question is silly or trivial. We appreciate that there might be a lot to take in at first, but don't worry, we'll send you a clear information pack about the treatments you're interested in, and we're always here for any follow-up queries. My team also manage inquiries about Care Pay, our range of funding packages which are exclusive to Care Fertility patients. When you're ready, we can book you a virtual consultation with a specialist fertility doctor from your local care clinic. So, if you want more information, have a question, or wish to book an appointment, call my team. We want you to know that we are here for you at every stage of your fertility journey. We say that our patients become part of our care family, and it's true. We care deeply about you and your future, and our teams are here to make sure you have all the support you need.
The reason why we chose Care was just, one, the care that they give you, the aftercare that they have available to you, and the fact that they offer different forms of treatment, and they listen to you. One thing that I've identified and what I've noticed when speaking to other people that I've met within the infertility community is there's a lot of clinics out there that don't necessarily listen to you as the patient. It was kind of a one size fits all, but with Care that didn't seem to be the case at all. They took everything into consideration, they listened to your concerns, they listened to you as a person, and they put a package and a process in place that will help you, and fingers crossed, will give you that positive result at the end of it. So without a shadow of a doubt, if I had to go through it again, I would definitely go back to Care.
Oh, the support at Care was brilliant, yeah. I mean, the nurses were brilliant for us. You feel so
looked after,
cared by the whole team. We felt that they did care, and it wasn't just for them getting something out of it. It was actually that
ongoing support.
Yeah, and they wanted it to work for us.
Care Fertility started over 20 years ago with one clinic and the goal of helping patients achieve their dream of family through truly personal care and the most scientifically advanced fertility treatments. We've grown from that one clinic. We now have clinics across the UK, and many people have become part of our care family with over 50,000 care babies in the world. But one thing has and always will remain the same. We care for each and every patient. We care about your dreams of having a baby, and we put our heart and soul into every aspect of what Care can offer you. To provide you with the best care possible and to give you your best chance of success and treatment, we look to our own care family. From our consultants, embryologists and nurses to our admin teams and specialist fertility counsellors, we've also put a lot of thought into how we improve each and every step of your journey, which will no doubt begin with lots of questions. We know that thinking about starting IVF can be daunting for some, and that's why our care, patient services and support teams will always be there for you whenever you have a question, need advice, or simply want someone to talk to, so that you feel completely confident and in control of your fertility options. So yes, we have grown and developed over the years, but care and empathy are always at the heart of who we are. We are passionate about changing lives and creating futures, and I hope that this shines through in everything we do and everyone you meet at all of our clinics. We don't just care, we are care.
One in 6 people need help to grow their family. You're not alone. And our care family will do everything we can to help your dream of family come true. There are over 50,000 care babies in the world today. And behind this success is our promise to make more heartfelt dreams of family become reality by ensuring our care goes into everything we do for all our patients every single day. You will receive truly individualised treatment, a patient-centric approach with empathy at its heart. We understand how nervous and excited you might be about getting started, but you can be assured of kindness, empathy, and all the information you need from our new patient inquiry team. We are all here to make it easy for you to take your very first step in your fertility journey. Call our team on 0800 564 2270 to learn more and book an appointment. We don't just care, we are care.